delicious. I just had a wonderful experience doing a virtual session with one of my first ever patients straight out of school. So I opened up my first practice in Florida, and this person was, if not patient number 1, patient number 2. It's hard to remember back then, but I know it's top 3 for sure. I haven't spoken with him for a while, so it was really cool to do a virtual call, and it got me really reminiscing to back in the day. So what I remember happening is this guy came in really looking for what I would call mechanical or structural care. See, he is an ultra marathon runner in his 60s, which is really hard to do. It's hard to do for a 20-year-old. But in your 60s, this guy's putting on tons of miles on his body, running, training, and competing. And he was having roaming pain, be feet, ankles, knees, hips, low back, and just kind of be moving one to the other. And so part of that, I explained to him, well, of course, you're just putting on a ton of miles, and you're getting older, so your recovery time is not great. But also, yeah, your knee hurts a little bit, and you've been training for a long time. Your body's smart, and it can organize itself, and so it just subtly shifts your movements to protect a compromised area. And now you're putting unnecessary extra strain on other joints when you compensate like that. And so that was part of it. But in my assessment, we discovered that he was running significantly into the sympathetic nervous system function. And it was my assessment and my recommendation, like, this is the primary thing we're going to have to work on, is retiming and rebalancing your autonomic nervous system. And this was hard. Again, just opened my first just my own practice where I was in charge of things, and he was like my second patient, and he wanted just kind of a quick fix, mechanical work done, like, pop my back, put it back in place. So people kind of think that chiropractors do. It's not exactly what we do. And as this young doctor, I had to tell him, like, okay, we're going to look at the mechanics of how your body's moving, but ultimately I think this is going to be the big thing for you. So let's talk about autonomic nervous system function. So you have a nervous system that is divided really into 2 categories, 2 primary functions, and this is really intelligent. And this is subdividing your autonomic nervous system, which already is a division of your nervous system. But autonomic, think automatic. It works without you thinking about it, just runs, okay? And it has 2 primary, you could call them modes of function. And the reason you have 2 is because you only have so many resources in your body. Think like oxygen, energy, blood flow, etc. And there's so many functions your body's trying to do at any given time. So what it does is it very intelligently just created 2 modes. Okay, in this mode, we're going to prioritize all these functions, and in this mode, we're going to prioritize these. And so the 2 modes really are sympathetic nervous system function, which people call fight or flight. And that's essentially your stress response. Those are your survival mechanisms. And then on the other hand, you have parasympathetic nervous system function. And this has everything to do with like rest, regeneration, digestion, immune system function, reproductive health, etc. So you could think like one of these is just like prioritizing health, and the other one's prioritizing stress, which is survival, okay? And one mode might sound better than the other, but they're both equally as important. It's just a timing issue. You want to be in the right one at the right time. All right, now here's the issue, and this is what's happening, and this is maybe one of the most prevalent things that I'm seeing out clinically since I started, is that we have a serious problem of being what would be considered sympathetic dominant, meaning we're supposed to be able to ebb and flow back between these based on perceived need. Like if there's a threat, we shift into fight or flight. If everything's cool, we're in parasympathetic, and we're healing, we're regenerating, we're digesting food, etc. What can happen from excessive sympathetic nervous system function, because you see, for our ancestors, life was generally pretty boring, and every now and then something pretty exciting happened, like you'd encounter another dangerous person, a dangerous animal, etc. But for the most part, life was pretty boring. Fast forward to our society, and there's so much stimulating things, or so many stimulating things, and our nervous system is not attuned to what's happening, and it doesn't really differentiate between a tiger in the room or going on Facebook, okay? And that's the truth. I'm not picking on Facebook. It's just like anything that our subconscious mind triggered as a potential threat, and it kind of learns these things as you are growing as a child, right? This is your ego developing, and what it decides is like, this feeling's not safe, this feeling's not safe, and then you can get on Facebook and all of a sudden you feel guilt or comparison, judgment, whatever it is, and that judgment triggers an old memory, and that memory kind of hijacks your nervous system, okay? Because your subconscious wants to survive more efficiently, and it's going to make rules as it encounters stressful situations. So it can happen if all these accumulated issues, in my technique we call these Semo Patterns, right? So that stands for subconscious emotional memory overrides. So what happens is, this happening subconsciously, you have an emotion that you feel in the present because of some stimulus triggered it. That's tied to a stressful memory, and then your body goes back into the needs from that memory versus the needs from now, okay? So what happens is, you start making so many rules that instead of every now and then shifting into fight or flight, that's just kind of where you are. That becomes default for people. And then you have to do things to get you into parasympathetic, into health mode, okay? So what is that for people? Well, that's things like meditation, prayer, journaling, yoga, whatever creative outlet you do, going for walks. These things get you out of the jungle, out of the danger, back into like your sanctuary, into your restful space. And it really should be the opposite. We should just be default in parasympathetic, because that's when your body regenerates, that's when it self-regulates, that's when it troubleshoots for health-related problems, not running for your life-related problems. So let's just go over some of these differences that you would see if you were sympathetic dominant, okay? One of the first things that changes is brain function. You go from having full use of your brain, primarily your neocortex, your frontal lobe. That's the part of your brain that allows you to think abstractly or conceptualize, or essentially step outside of yourself and say, like, what's really going on here? Why do I feel this way? Why is this person acting this way? Why is traffic so bad? Whatever it is. And you create context and say, okay, I'm not really in danger. When you're in fight or flight, you go into your midbrain, your emotional centers that, well, create reactivity in your life, right? So now you're not necessarily controlling your actions and your moods. It's just you have the stimulus, and then you have the programmed reaction, which for some people could be anger, some people can be anxiety, depression, whatever it is. Okay, so now you're filtering your life through how you feel, instead of getting to use that great neocortex that says, like, what's really going on here? You've lost that ability altogether. You also lose language centers, which is why when people are under stress, sometimes they really have a hard time communicating. And that's why sometimes when you're in a fight with someone that you care about and it's not being productive, maybe it's just like, it's okay to take a break. People can go on walks, get full use of their brain again, and then come back and then try to sort something out again. Okay, brain changes. Digestion changes too. Blood actually leaves your viscera, leaves your guts to go to certain muscles for running and fighting. Okay, so when that happens, gastric secretion, so all the enzymes that you produce to break down your food, goes away, and the gut motility, the motion, the muscular work of moving food through your body, that slows down, becomes sluggish, or just stops completely. Other things that can happen there is, well, if you don't have any blood in your viscera, like, you're not going to be pulling nutrients out, right? So even if you were breaking down your food, which you're not, but even if you were, now you're not really absorbing nutrients either. So food kind of sits there, becomes stagnant, ferments, creates gas, creates constipation, and then also with intermittent diarrhea over time. So that's the reality of it. That's kind of the description of IBS. IBS untreated over time can turn into all kinds of other things like Crohn's disease, diverticulitis, things like that. Ulcerative colitis. Okay, so that's digestion, that's brain. So we already have a bunch of mood disorders that have been kind of explained, or at least can be correlated. You have digestive problems that can be correlated. You can also eat a perfectly good diet and not get the benefits of it because you're just not breaking down food and you're not absorbing it. So you can still be nourished, and you can also be paying for really nice supplements, getting nutrients into your system, but then again, not absorbing them, not utilizing them properly. Okay, So we talked about two things. Let's talk about muscles too, because a lot of things that I see are going to be chronic pain. Okay, and this is what we were dealing with my patient from a long time ago that I mentioned. Is he just, I mean, he was getting older, but he just wasn't recovering from training like he used to. And it's like, well, your body's not prioritizing healing and regeneration. Healing takes a lot of energy, and when your mind says, our energy will better be served running or fighting for our life, and when we feel safe, then we'll reprioritize. So you're making completely different hormones. So under stress, you're making cortisol, which actually breaks down tissue a little bit to liberate stored glycogen. So it spikes your blood sugar essentially to give you more energy to run. And you're making cortisol in lieu of making hormones like human growth hormone that signals repair and healing, testosterone signals repair and healing, estrogen, progesterone, all these things signal repair and healing in your body. You're making cortisol instead, which very useful when you need to spike your blood sugar, not very useful when you're sitting in your cubicle or when you're laying in bed at night thinking about your problems. Okay? It's a timing issue. Fight or flight's perfectly good, but not at the wrong time, and not over extended periods of time, because you're not really designed to operate like that for a long time. I mean, you could think about like driving your car like pedal to the metal. Your car is designed to be able to do that. But if that's how you drive your car, if you drive your car hard like that all the time, your fuel economy is going to go down, so you're going to be wasting energy. But also just wear and tear on every little part of the car, which is like tires, suspension, steering, whatever it is, or you're going to wear your car a lot faster, and that's true. So if you're in sympathetic dominant mode all the time, you're going to wear out faster. On top of that, cars don't fix themselves like we do. You're suppressing the components of yourself that slow down the fight or flight response, but you're suppressing the things that initiate healing and repair. Also, immune system function. We haven't even gotten to that, but when you're in fight or flight, you're suppressing immune function. Immune system takes a ton of energy. We know this. Think about the last time you got a cold or flu. When you get an infection like that, your body goes, okay, we're going to slow down everything else and just focus on this. So that's why you have no energy. You're just bedridden because your body's prioritizing what it thinks it needs in that moment. And that's what happens with fight or flight. Your mind thinks that there's danger, you're going to have to run or fight for your life, but you're really just sitting on your couch on your phone. And then you don't even know that that's happening because it can become so normalized you can't feel that you're in fight or flight. All right, a lot of my clients, my patients, they can retrain to know like, okay, yep, this is happening right now and it's totally okay, but just become aware, like put yourself back in the driver's seat, back in control, so you're not having your physiology hijacked by memories, essentially, okay, by old traumas. This has been a long enough video. I want to talk about this more, and I probably will, but comment with any questions you have, or just, any other insights that I missed out. It's a big topic. I barely got into it really, but it's an important one, so probably talk about it more in the future. All right, guys, thanks for tuning in. Like, subscribe to this channel so other people can see this, and then just share with people that, we all have that friend or family member that's like mega stressed out, and they're just like wearing themselves out. They have no energy. They have no ability to really regulate mood. It's like, send them this video and give them a little loving intro to something that, the good news about this is when you find out that you're sympathetic dominant, like a lot can be done about that, and in a short period of time where you're going to be feeling better very quickly. At least that's been the case with 1,000+ people I've helped in that area so far. All right, bye guys.